from Datapalooza again. So I have finally gotten some speakers from the main stage. Thank you so much for joining me. Would you please introduce yourselves?
Well, thanks for having me. I'm Jacqueline Trabati. I'm a cardiologist based out in California, and I'm the senior clinical lead for consumer health at Google. My role day to day is very much working with other engineers and product managers building consumer health tools that you might find on a Pixel Watch or a Fitbit or the Pixel phone. If you're an Android developer and are developing health and fitness apps, I also support the internal policies that help us get those apps to be safe and effective and on the Play Store.
And I'm Mike Wohar. I'm the Chief Medical Officer of Microsoft Federal, which is our federal subsidiary that serves the United States federal government. My role is obviously to help Microsoft's kind of transition away from just being enterprise software to being much more embedded with workflows, healthcare workflows, and healthcare organizations, and specifically within the federal government, which are some of our most important customers to Microsoft.
So let me give you a little bit of background on the stream, and possibly also for the stream viewers, and this will be up on the web forever. In general, it's too costly for Academy Health to stream everything. So we're trying to make something accessible for patients. So a lot of patients can't attend. Datapalooza has been historically a very patient-centric conference. We've invited patients into the room. But a lot of patients can't travel because of the recession. Still, another group of patients can't make it because of immune compromised situations. I don't know whether we're at the end of a pandemic or in the middle of an endemic or beginning. I'm not sure where you are with COVID, but because of that, people still can't travel. So, I think some of the things that came up in your session today, I did not get to watch it, but talking about ChatGPT and how AI is going to impact. And I think being an insider at big tech, you have seen these kind of chat interfaces to AI systems internally more than I think people have. And they really have been amazing for a long time. And I think the public is really awakening to that with ChatGPT. Not necessarily the same surprise to people who are insiders to the industry and machine learning. I would love to hear, though, how you think this kind of technology is going to impact patients specifically. What do you think?
You can go first.
Oh, okay. I guess I'm the resident ChatGPT expert, right? As a representative of Microsoft, I will say that yes, I'm not surprised to answer your question of how powerful large language models are. And I think we were talking earlier that we've invested an enormous amount of time, resources on this problem of natural language processing and large language transformers and the ultimate application. And I think this has certainly changed the social aspect of it, and the realization that these technologies can be immensely helpful. Is putting a chat interface in front of a GPT-3 model. But we've known for a long time at Microsoft how powerful these large language models are. And specifically in healthcare, we've had a commercial product called Text Analytics for Health for over a year that, uses a large model specifically trained on healthcare language, not just general language. And has very specified use cases, namely one of them being helping abstract billing codes and abstract text, doing named entity recognition, and then ultimately association with what we would call clinical terminology services and so forth. Those are, commercial products, and they have an extremely great value proposition because they also take data and standardize it. So rather than, medical organizations and healthcare organizations having so much unstructured data that they can actually make sense of some of their data. So no, not surprised. It is exciting to see that the popular, pop culture is taking up ChatGPT in some respects, but it's also a moment to pause to do so and make sure that it's being done responsibly, and specifically on the OpenAI APIs, which are now on Azure in a gated preview, which include GPT. Those precautions that we've taken to make sure that when they are released, even in this pre-release version, having a gated preview, making sure that the use cases are very well understood before just releasing it to the larger community, because as we've seen, both with Bing and the chat features that have been built into Bing, or in Chat GPT specifically, it's pretty easy to trip up the system and put it down a rabbit hole towards, saying inappropriate or out of context things, which is not our intention at Microsoft, obviously.
So I think one of the challenges, but also opportunities for these chatbots, or ask a question, get back relatable, emotive feedback like you could get from these conversational AI experiences, is that we're often looking for a singular answer, and these language models are very good at spitting out an answer, and it may not be reliable. I think a lot of patients can be frustrated because they ask a doctor one thing, and then they ask another doctor the same question, and they get a different answer. And the reality is we're operating very often with limited information, or there's no one right answer. That can be incredibly frustrating for patients. It's frustrating for doctors. If you're trying to get additional feedback from peers, they may all have different opinions about how to treat the same problem or disease process. So it's a complex field, healthcare, because we don't have black and white answers.
So it's a beautiful segue to my next question. And so there's a physician online who wanted to challenge a denial of insurance. You may know this, but I'm relaying it I'm telling you, but I'm also narrating for our audience.
Yeah.
And he got a denial for a patient, and it was something to do with PSA antigen test hadn't been done on someone, and he wanted to do an MRI anyways. And the standard of care apparently was this, and the insurance had denied the MRI. And I'm not a clinician; I have no idea. Like I'm just echoing these things. Sure. I have no understanding what they mean. Sure. And so he said, prompted ChatGPT, write me a letter to the insurance company, say it's from me, include references, use forceful but respectful language. These kind of things that are really subtle. And sure enough, out comes this letter that did include references, and did include references to PubMed about the use of an MRI for this situation. And then, just for giggles, I went and I wrote exactly the same prompt, except I said a letter from the insurance company to the physician telling why the opposite, that this case would be denied. And sure enough, with references, ChatGPT came back with, for what me as a layman, being somewhat familiar with clinical language, can say, well, it seems both letters seem totally reasonable to me. I couldn't tell the difference in terms of like immediately seeing what was right. And I think that talks to your point about, like, you in real life, you talk to two doctors and you get two different answers. Well, here's an interface that's capable of arguing for both positions at the same time. Do you have any kind of reaction to that?
I mean, I think any opportunity for, within reason, for consumers to have more advocacy and to be empowered to represent themselves and represent their situation, like, these are fabulous opportunities. Now, how they translate into products that are in the market, like, that's a different question, right? But this opportunity to say, like, look, I don't have the language, I don't have the capacity to say what I need, and here is a tool that's helping me, like, vouch for myself. I think that's a really poignant experience. But going back to, like, the healthcare situation is, like, we operate in ambiguity. We often operate with little to very limited information, or the medical education that we received doesn't exactly fit the situation at hand. So when you operate in grayness, it can be hard to say for certain how a large language model will help make it black and white. It won't change the underlying ground truth, which is still, like, we don't know. There's clinical equipoise. We're not sure.
Yeah, the reason why there was a debate between the insurance company and the doctor in the begins with is precisely because it's a gray area. Right? Yeah. There wouldn't be a debate if it wasn't.
But, like, patient advocacy, I'm totally for that. I think that's fantastic.
That's really interesting.
Yeah. And I also think that we've seen with irresponsible sort of implementations of that sort of technology is that if you ask it to do a prior authorization for something that is completely inappropriate, which is, I believe that there was another example by someone who's doing something very similar, to put a patient on a blood thinner for seizure.
Tincture of rosemary.
Right. Something completely inappropriate. Yeah. And the interface provided an answer, which clearly there is no indication for this, right?
Interesting.
And so I think that speaks to when these products are implemented. Ultimately, when we do arrive at a product that goes on the market, it needs to be done so with guardrails so that those types of outcomes are either don't exist or are far less likely to happen. Now, every doctor has been wrong before too, right? We're never going to correct medical error, and technology can sometimes get it wrong or spit out an inappropriate response. But what we're seeing is that it will make a case, or the large language models will hallucinate and make a case for something that is medically contraindicated, right? And so I think that in lies how you implement the technology needs to be done so with intention, needs to be done so responsibly. And then, the use cases need to be very clearly defined on the front end, not, oh, we have a large language model, let's figure out what we can do with it. No, we need to actually build those intentions into the product so that when they are released, that they do the least amount of harm.
So that's brilliant. I just grabbed them as they were coming off the stage, and they were generous to give me a few minutes, and I wanted to kind of keep it short.
Yeah.
Is there anything you wanted to say before we?
I think so. I mean, I think if we have a lot of patients in the audience, they're probably asking, like, there are doctors at Google and Microsoft, like, what is going on? So I'm happy to kind of give an overview of, like, what does that mean? Because I think people are there's people at Google who don't even know that I'm there. They're like, why are you here?
Well, two audiences then.
My wife doesn't even know I work for Microsoft. This is a coming out party.
So Google's a large company. We have a company-wide initiative to support health projects that are, in service of some of our core expertise, right? So Google organizes information. They are, pioneers in AI and machine learning. We have a rich developer ecosystem of Android, Play Store, Pixel Watch, Wear OS, and the like. So we support health services and products, policy that involve anything that touches health. So we have several dozen physicians, and we work in varying capacities. But you can imagine if there's a health search on Google.com, you might need a clinician or a clinical informaticist to help support that journey to make sure that we are directing people to the right local facility. I've recently learned that we have tens of millions of people each day going to Google and looking for, like, doctor near me or hospital near me. So especially during the pandemic, that was important to get it right. Where were vaccines located? Where were doctors located? YouTube. People go to YouTube. I think in 2021, there were 12 billion views of health videos right during the global pandemic.
Wow.
So how do we make sure that we have authoritative, credible information, that we're surfacing, like, the good stuff and minimizing or making it harder to find the bad stuff? So we partner with National Academy of Medicine, the WHO, Kaiser Family Foundation, and develop, those partners have developed a framework for thinking about credible sources, and then we work with partners to help source that content. So uplifting kind of the good content so that whether you're a doctor learning how to do a lumbar puncture or you're like a patient with a new diagnosis of breast cancer, you can go to YouTube and learn more from reputable sources.
So, with no disrespect to Bing, something that most people don't know is that the number one search engine in the world is Google, and the number two search engine is actually YouTube. So most people who do not use Google to find things find things on YouTube. And people
I think visual search is kind of where it's going.
It's where it's going, right? Yeah. So, and I certainly, that's a good example. Whenever I know I need an explanation and maybe I need to see something, I'll go to to YouTube first, or click over to the video search that is part of the main Google search. And I've been really pleased with that. I am actually also really excited about the search options on Bing for healthcare stuff. I think there's some really interesting things you've done. May I ask the question that you implicitly brought up? What is it like to be you are a physician as well? I
am.
At Microsoft.
When you figure out what a chief medical officer of Microsoft Federal does, you please let me know, because I'm still trying to struggle to figure it out every day. But I'd like to think what I do is to serve as the translator between our customers and our technologists. Healthcare speaks a different language. Practically speaking, we train language models over healthcare language, but also just speaks a different language, a different lingo. There's different ideals in healthcare. Patient safety means a different thing to a healthcare entity, a physician, than it does to a technologist. And so to serve as the translator between, in my case, our government customers, our strategic government customers that have made massive investments in Microsoft, our cloud offerings, our CRM solutions, and others, and want to be able to use those powerful technologies, those powerful platforms to build healthcare use cases, to impact patient safety, to help with patient scheduling across a massive network, to build chatbots as we did with the CDC that help do a concept called forward triage, which is triaging at a distance instead of actually physically, seeing an emergency room doctor or picking up the phone and calling. Some of the first implementations of a chatbot were done by the Centers for Disease Control and Prevention on Microsoft technology, which is our HealthBot technology. And, doing so requires someone to help our technologists, which some of the smartest people I've ever worked with, but naturally understand technology and not necessarily healthcare. And I said this conference, I think there's an inherent distrust of both society and in the context of healthcare systems in technology, because they as the community feel that technologists and big tech especially does not understand healthcare. And so I see my job as to serve as that translator, to serve as the interface between our customers, our partners, patients sometimes, and technologists, to help them leverage and get the most out of our platforms that the enterprises have made investments in. So I try to translate on a daily basis, and hopefully that brings some value to both sides.
So I want to be respectful of their time. They had no idea that they were going to be sitting here and answering my questions. We'll do a little bit better, Jeb, next year of letting people know that they might be taken to a random room in the hotel. But I wanted to thank you, and I wanted just to thank you very much. It's very obvious that you are both very thoughtful people, and it makes me, as a patient advocate, super happy to know that there are people who are thoughtful working at Microsoft and Google to make their technology better for patients. So thank you. Really appreciate your time.
Thank you for making this channel available. I feel like
Yeah.
the closed door nature of conferences can really undermine the mission, right? So this is really important.
Absolutely. And we think we're going to do more of this. This is an experiment. This is the first year we're trying this, and this may be all the conferences. We may just rent a bunch of rooms with video cameras.
But inbound questions would be great.
It would be. It would be. I didn't see anything move here, so that was for the last session. Maybe. It's the last question, which is about fire. I'd love to ask you about fire. I think fire is super important, but I want to be respectful of your time. So I will not ask you the last session's questions. But thank you so much for being here. I really appreciate it. And I'm going to press the button to stop now. So goodbye, everyone.